Hello, I am Dr. Sanjay Yadagiri, working as laparoscopic and surgical oncologist at Renova NIGL Hospital at Banjara Hills, Hyderabad. Coming to the generally, people keep asking us, why do we get cancer? Although some habits like smoking in cases of lung cancer and gutka chewing in cases of oral cancers can be attributed, most of them we cannot attribute reasons to it. All that we can do is assure the patients, ask them to come early so that we can screen them and catch the disease early. The trick here is to catch the disease early in those unfortunate ones who are diagnosed with cancer. Yes, genetically also some cancers run in families, but it's a very small percentage. So here I would like to say it is more of a because of our change in lifestyle and also in food habits which we have imported from other countries. For example, like colon cancers have increased many-fold in our country where they used to be very minimal. I think it's because of our food habits and lifestyle changes. Coming to the treatment of after the diagnosis of this cancers, it is not enough only to get a diagnosis. We need to something called staging to apply what kind of treatment has to be done for which cancer at which stage. Patients keep asking, sir, which stage is this cancer to my mother or father or my relative? For that to answer, we need to do further investigations, now most commonly used, called the PET-CT scan, where we get to know the entire status of the disease. And based on these and other investigations and clinical examination, of course, we stage the disease and then we offer them treatment. Mainly in oncology, in cancer treatments, there are three kinds of treatments: surgical, medical oncology, that is chemotherapy, and radiotherapy. In surgical oncology, we need again on screening whenever we catch the disease early. That is the best result what we can give is by surgery in early diseases. The more progressing the disease happens, then the role of surgery comes down and we can only attribute as an adjuvant treatment later on along with chemotherapy and radiotherapy. So again, the trick is to catch the disease early so that we can do an effective surgery, a complete surgery, and probably a curative surgery. So as a surgeon, coming to the surgical treatment management of cancers, I would like to say that we have the latest innovative methods which we implement, like laparoscopic surgery, where compared to conventional surgeries, there is a definite advantage for patients' faster recovery and shorter hospital stays. So what is laparoscopic surgery is, instead of conventional long incisions on the abdomen, we use small, the biggest would be a 1 centimeter incision, where we put the camera inside the abdominal cavity and visualize and operate with thin instruments so that we don't have to make a long scars over the patient's body. By this approach, we can handle cancers related to stomach, intestines, kidneys, and gynecological malignancies in women. By this approach, we cut down the patient's hospital stay, patients recover much faster, and they get to move on with their life and their jobs as soon as possible with a much faster recovery compared to open surgeries. Also, the infection rates of the wounds comes down because there are smaller scars. Breast cancers are also on the rise and we see them much more in younger women also, which was never a case earlier. So to again take care of these patients, the early screening by investigations like mammography, ultrasound, and tumor markers, we try to detect them early and we offer them conservation surgeries where we can remove only the lump and not the entire breast, which will be an emotional trauma on a woman. Apart from this, we also handle thyroid cancer surgeries and also oral cancer surgeries with plastic reconstructive surgeries taking cosmesis into account so that patient is retained back into his own self as close as possible to his own self. Thank you.